Hello, my name is Paula Quigley. I'm presenting today on behalf of DAI Global Health. DAI is an international development organisation, and the title of this presentation is Improving Nutrition Programming to Reach Vulnerable Populations, Practical Guidance for Implementers. So as a background to this guidance, obviously nutrition is a basic human right, but we know that many people around the world have serious problems with access to healthy diets. So the latest Global Nutrition Report has estimated that many children around the world are currently stunted, 149 million, 45.5 million almost are wasted, but also at the other end of the spectrum, over 40% of all men and women, 2.2 billion people, are now overweight or obese. So we clearly have a big problem with nutrition. In 2021, the Foreign Commonwealth Development Office of the UK government commissioned our project, the Technical Assistance to Strengthening Capability project, to develop a series of guidance notes to help improve their nutrition programming. And this was in response to a review of the, at that time, DFID portfolio of nutrition in 2020. And this guidance was then subsequently adapted this year for external partners, and that's what I want to share with you today. So there are 4 sets of guidance notes, and the first one is about improving reach to those most at risk of malnutrition. The idea here is that, of course, we want to promote equity and ensure no one is left behind by nutrition programs. So this guidance is really specifically to reach out to those most at risk, to identify those populations, and to help address their nutritional needs. So it presents evidence-based options to achieving healthier diets and greater access to high-impact services, and at the same time mainstreaming gender and social inclusion, the theme of this conference. So who are these groups? Well, 6 priority groups were identified, and these are not mutually exclusive. So of course people can belong in several of these groups. The first one is children, adolescents and women in deeply rural, remote or physically isolated settings. The second one is children under 5 and women from pastoralist and nomadic groups. The third is ethnic, tribal or indigenous groups. The fourth is children and adolescents with disabilities. The fifth is children in urban and peri-urban slums and informal settlements. And the last one is internally displaced people, refugees and returnees. And people from these groups, and of course they're not all vulnerable, but many of them are. They're the highest priority groups, and many of them experience deep-seated vulnerabilities and extreme marginalisation. So what is the guidance about? It is about finding modalities that can help you to have better interventions to reach these groups. And it talks about a number of different areas. The first is social and behaviour change interventions. The second is women's empowerment interventions, parenting or group models, cash transfers, food transfers of other types, capacity building of service providers to better serve these at-risk groups, strengthening the linkages and referrals to various services and markets, mobile phone technology and disability inclusive strategies. And the guidance takes you through all of these areas and helps you to design or implement programs that better reach these at-risk groups. So the second note is about promoting better nutrition through social assistance. The idea here is that social protection programs and the most vulnerable groups are, it's a meeting point and an entry point for nutrition programming. So obviously social assistance programs are trying to reach the most vulnerable, and these can be supplemented with better programming to ensure that nutritional outcomes are achieved. So what does it look like? There are 4 pathways that support nutrition aims through social protection. The first is about improving food security and everything that goes around that. The second one is about improving caregiving resources at both the maternal level, the household level and community levels. The third is about improving access to health and nutrition services. And the fourth is around contributing to a safe and hygienic environment. And the how is about looking for opportunities that are related to advocacy and policy action, not just programming. And again, the guidance takes us through all these different areas and gives very practical steps on what you can do to maximize the impact of social assistance programs. And this is by ensuring that financing commitments are transparent and are offering value for money, engaging different stakeholders around the benefits of social assistance programming that are particularly adapted to meet the needs of these nutritionally at-risk groups. And it's about enabling fostering an enabling legal and regulatory environment for social protection so that it supports better health and nutrition. And again, the guidance will take you through all these areas. The third guidance note is around aligning food systems activities with healthier diets for particularly low-income households. The idea here is that, of course, we know healthy diets can prevent all forms of malnutrition, and that's both sides of the spectrum again, those who are stunted or wasted, but also those who are obese or overweight. Enhanced food systems can positively impact on the quality of food, where that food is available, what it costs, and the way that different foods are promoted. So the guidance will help you to design programs that strengthen food systems, and it will help you to conduct policy engagement so that these kinds of programs can be delivered to the most vulnerable people. So who is this guidance prioritized for? It's prioritized absolutely for low-income households with special attention to women, children, and persons with disabilities. So you'll see there's a lot of cross-reference across the different guidance notes, and they each support each other. So you can use all of them for different parts of your program. These individuals in low-income households, they often face extreme financial insecurity that limits the food that they can get hold of. They often have limited resources and skills to prepare nutritious food, and there are potential, of course, constraints related to gender and cultural norms. And again, the guidance talks us through all these and how we can counteract these challenges. So this one's a bit lengthy. There are 9 key activities or activity areas that are highlighted in this guidance note, and I'm just going to highlight the 9 for you, and again, go to the guidance to get all the detail. So the first is around improved crop production practices. The second is around maximizing the benefits of animal production so that it can be best tailored to low-income households. The third is around linking producers of perishable nutritious foods to markets, particularly those serving low-income households. The fourth is around cross-border trade, so import and export of healthier food and how this can be better managed and leveraged. The fifth is around food processing and manufacturing so that countries can actually enhance the development of better quality, more nutritious foods. The sixth is around mobilizing demand for nutritious foods from low-income consumers. The seventh is around using innovative digital technologies and solutions to improve access and affordability of nutritious foods. The eighth is around innovative financing solutions and how these can be incentivized and supported, that is in a commercially sustainable and scalable way, which is of course interesting for the private sector. And the last one is about building capacity for designing and implementing agricultural and food policy for healthy diets. So finally, the last guidance note brings these all together and shows us how we can better monitor and evaluate nutrition relevant programs. Of course, if we enhance our M&E systems, then we are better able to show success and also areas that need more action, and we can communicate learning to others. So the guidance will help program teams to strengthen their M&E systems, to make sure that they are finding where the nutrition investments are going, if they're going to the right people and having the right impact. And it will help people to integrate M&E into both the design and implementation phases of the project cycle. So this takes 5 sector-specific pathways, and these pathways are around health, water, sanitation and hygiene, WASH programs, agriculture, food systems, and social protection. So again, you see the links back to the other guidance notes. And who are they targeting the M&E on? Again, it's these disaggregated groups where you can see where you most want the impact and if you're getting that impact. So it's children under 5 years, adolescents, women of reproductive age, pregnant and lactating women, mothers and caregivers, households and communities. This guidance is accompanied by an Excel file, which is an indicator tool, and that is a list of different indicators with some guidance on how you can identify the determinants or outcomes that you want to monitor within a particular focus or sector, selecting the step in the pathway you want to monitor, selecting relevant indicators for that step, and then it helps you to delve deeper into the practical information on the measurement and interpretation of each selected indicator. So there's a lot of guidance there that will help you build up a better M&E system. So that's it. Thank you so much for listening. I know it's a lot, bit of a huge lot to absorb, but the guidance notes all have executive summaries. We've also got an overview document. It can all be found on our DAI website, and there are embedded links in this presentation, which you can click on directly once you get the presentation. So thank you very much for listening, and happy to answer any questions. Thank you.